You're listening to All Hands on Tech. Come along as we get to know the people and businesses behind the province's ever-expanding tech sector.
Each episode, we'll chat with local experts to uncover the hidden gems that make Nova Scotia a hub for collaboration, innovation, and creativity.
All Hands on Tech is proudly produced by Digital Nova Scotia, the industry association for Nova Scotia's growing tech sector. Hey, welcome back to another episode of All Hands on Tech. I'm Eilish.
And I often wonder why we call it rush hour when nothing moves, but you can call me Greg. And today we're exploring the groundbreaking innovations shaping the future of healthcare here in Nova Scotia.
Oh my.
Caught myself off guard for that one.
It's great when you make yourself laugh, Greg. All right, back to business here. Virtual Hallway is a revolutionary platform that's transforming how primary care providers and specialists collaborate. Made by doctors for doctors, Virtual Hallway leverages technology to bridge that gap between rural and urban healthcare, enabling doctors to deliver timely, high-quality care.
So to learn more about the web-based platform that's changing the game in healthcare, today we're joined by psychiatrist and one of the founders of Virtual Hallway, Dr. Daniel Rasic.
Hello, sir. Thanks so much for making the time.
Thank you. Thank you for having me here.
We're excited to have you here. You guys have seen some very impressive growth very rapidly, and we'll get into all of that in just a minute. But first, we're going to hit you to kind of shake some of those nerves and lighten the mood a little bit. We're going to hit you with some icebreaker questions. Are you okay with that?
Okay.
We'll see, hey?
Yeah.
You're here, you're stuck, you don't have a choice, I'm sorry. All right, so first things first, we're going to get down to the very important details about your life. We're starting with, what is your go-to karaoke song and why is it such a hit?
Oh my. Let me think here.
Hard-hitting questions to get you started.
Yeah, I don't have to sing it though, do I?
No. Bonus points if you do.
Yeah. My go-to karaoke, it's been a long time.
Karaoke can also be considered yourself in the car, windows up, music blaring. So if there's a song that you just constantly put on repeat that you like to just sing very loudly to, I'll take that.
Been listening to Zach Bryan lately.
Okay.
So
Yeah.
maybe one of his songs, I'd say.
Okay.
Yeah.
Okay.
Nice. Okay. Pretty low-key. Yeah.
If you were stranded on a deserted island, what 3 items would you bring?
My laptop,
Okay.
my charger. No, I get it. I can't bring this. Okay, so 3 items on a deserted island. With me, I would bring a soccer ball,
Okay.
a copy of Zen and the Art of Motorcycle Maintenance,
Okay.
and a snorkel.
Oh.
Nice.
Okay.
Yeah.
At least a snorkel while I'm there.
May as
Now-
well. We're stuck there. We gotta have fun.
Yeah. I was thinking food, but yeah, that's
Oh, right.
yeah.
Well,
The
it's a
food
way to
part.
get
No, I
food,
meant
I guess.
the snorkel could help with food. That's
Yeah,
where my brain
yeah.
went.
Okay.
Yeah. But okay, so are we talking? Are we going to be turning the soccer ball into like your friend?
Wilson?
Or, well, thank you.
Yeah.
Or is it just to like pass the time kicking around?
I guess it would. It was originally to pass the time, but
Okay.
I would need a friend.
Maybe a little bit of
Yeah.
both.
Yeah.
Okay. 2 things can be true at once. Okay. If you could swap lives with anybody for a day, who would it be? Maybe you don't want to. Maybe life's great.
Life's pretty great.
Nice.
At this time of year, just
Yeah.
anyone who lives in a warmer place
Ooh,
for a day
Yeah, I
would
feel
be
that.
nice. Yeah.
Yeah, it is
Yeah.
cold out there today.
Yeah.
Yeah, it's chilly. It's chilly. Okay, those are all very good answers, and hopefully the hardest questions that we will be asking
Okay.
today. Okay, let's dive into Virtual Hallway, what it's all about, who you are, and how it came to be. You are a practicing psychiatrist by day, by night, one of the founders of Virtual Hallway. What inspired you to pursue this career?
So actually at the present time, I'm not really a psychiatrist by day anymore. I'm predominantly actually at Virtual Hallway. So I still practice a small amount, but I'm mainly working at the company.
Okay.
So what inspired me to start why I became a psychiatrist. What interested me in psychiatry was, quite honestly, when I got into medicine, shortly kind of as I got into it, I kind of realized it wasn't quite for me. I was sort of kind of trying to figure out what I was going to do with my life halfway through medicine. And it was probably, I think, towards the end of my second year, I had a bit of exposure to psychiatry, so you kind of rotate around from one specialist to the other. And that really sort of sparked something within me. I really enjoyed how psychiatry is very gray, like in terms of it's not black and white, whereas, a lot of medicine, there's an art to it, but there's a fair amount of algorithmic kind of thinking. And I found that maybe a little less interesting for me, just the way I kind of think. So whereas psychiatry is very much kind of open-ended, and I always kind of really found it really interesting how it kind of gets at the core of, who we are as humans, and being able to connect with people and your patients and whatnot really kind of spoke to me, and really that kind of thrived in that environment, and
Cool.
and that's sort of why I got into psychiatry.
Nice.
Wow.
Yeah.
I feel like it was probably pretty daunting to be 2 years into medicine and realizing, whoa, maybe this is not it.
Yeah. No, and I think it was very, it was a bit kind of like, ooh, what do I do now? And I mean, I think that's probably common for some people.
Oh, gosh, yeah, I'm sure it is.
Getting into medicine, it's sort of like you're just hitting one goal after the next, right? Like, okay, the next goal is to do this, and then you kind of get in, and you're like, okay, what's the rest of my life going to look like? And that was sort of that point. It was like, I don't really think this is what I want the rest of my life to look like. Again, until I found psychiatry, it just kind of realized I had to make a decision. So, yeah.
And then you made a very different decision.
Yes.
Well, maybe not very different, but.
I was going to say, on the psychiatry side of things, before I ask you this next question, I've been watching from start to finish Frasier.
Oh, yeah.
I've been watching that. And it is, like obviously that's set in a sitcom, but just interesting to see, theories and different interpretations of, how to deal with problems. I think that's pretty amazing. I did some of my intro to psych courses at, when I was in business school, and we had to do something else, and just the surface level stuff and realizing how deep you could go. Truly fascinating. So, it's the side of medicine that I just never had the ability to get to that level, but have a deep appreciation for. So, talking about sort of, your journey, can you share the story behind the founding of Virtual Hallway? And is it true that it all started in a coffee shop?
I guess maybe the initial spark of the idea.
That was my
Frasier,
connection.
The
coffee shop for sure. It was weak, but it was there.
So the spark of the idea really did come in that sort of scenario. So really the idea essentially came up because of just this encounter I had with a family doctor. So, there's just like this huge problem across Canada, particularly in the Atlantic provinces, that it is super, super hard to get to see a specialist.
Yeah.
So you talk to anyone, on average, a person's going to be referred to a specialist every 2 years. And so everybody needs a specialist, but the problem is the wait times to see them can be anywhere from 1 to 2 to 5 years, depending on your problem. And that's just not very good for anyone. It's actually bad for everyone. Yeah. And at this time where this sort of encounter happened, this was like I'd say like a really bad time for psychiatry in particular. So wait times for psychiatry in the province at that time were, anywhere from 18 to 24 plus months.
Wow.
So you just kind of imagine the level of anguish that people are experiencing during this time.
Well, for something like mental health, that's just it's unacceptable. It is quite honestly
beyond unacceptable.
Yeah.
And even you think about, by the time someone actually refers someone, that person's already been suffering for a very long time. So you see your family doctor, then you refer them to a psychiatrist. Yeah. And this was sort of where the world was at, or at least Nova Scotia. And so wait times for psychiatry were at all-time highs across Canada, and Nova Scotia was the highest in Canada.
Great.
So it was a very, very difficult time. And of course, then we'd end up seeing, so myself as a psychiatrist, and I say we because two of my co-founders are also psychiatrists. Okay. You'd end up seeing someone and think, wow, like if we could have intervened early, This person might not have been off work for 3 years, or a whole host of problems that can happen. So anyway, the sort of this encounter was really just with a family doctor that I knew a little bit, and she just had this question about a patient who was on a wait list, waiting to see a psychiatrist, and just kind of wanted my opinion or some advice. And it was really nice. We talked for 5 minutes, and we're able to really kind of flesh out a lot of the case and come up with like 2-3 steps that she could take. And that was really the aha, because I was like, okay, well, that was 5 minutes, and we came up with a plan, and that person now doesn't have to wait 2 years for that advice. And when you see a psychiatrist, it's going to take them 90 minutes versus this was 5 minutes. There's just like this real kind of thing here. And that was sort of the kind of like, okay, how do we make that moment happen all the time? And that's sort of how it all started. Wow. Yeah. And like literally like immediately after that, I ran, so Jacob Cookie, one of the other co-founders, his office was up the stairs from mine. So like I ran up and I like knocked on his door. I'm like, Jacob, we've got to figure this out. And then he was like, oh, this is a good idea. So then we kind of started trying to figure out how to make that happen.
Okay.
Amazing.
Our next question was, going to be, we know that healthcare in the province is in a little bit of a tough spot. What problem were you trying to solve? That's exactly it. It's that wait time. It's that time in between where these patients, seemingly anyway, speaking from a third-party observer here, that time in between where a patient has finally decided to get themselves care, to when they actually can access that care.
Yeah.
Yeah. Interesting. Okay, so with that in mind, then, at its core, what exactly is Virtual Hallway? Who's accessing it? What are they doing with it? Give us all those details.
So basically the way Virtual Hallway works is really simple. It's an app, so you can access it on the web, or there's a mobile app. And whenever a doctor or nurse practitioner or pharmacist now needs the advice of any other doctor, they just use our app to connect to them, and they get to have a conversation. And they talk, they get advice, and they can implement it. The app does a few other things. It includes documentation, it can bill for the doctors and do all sorts of things like that. But the main thing is it just kind of connects them. So you can think, maybe as maybe a rough comparison, Uber or Airbnb, it sort of makes it like that. Okay. So people can just connect.
From point A to point B.
And that sounds simple, but it did not exist before. And wow. The way that, if you ever wanted to try to get a hold of another colleague, it would be, well, if you ever tried to call your family doctor or specialist, you'll typically get a dial 1 for this and dial 2 for this, and then you do that, and then you get put on hold, and then you might get through, and then, of course, the person you're trying to get a hold of is busy, so then they're going to have to call you back, and then when they call you back, they're going to get the dial pad, press 1 for this, and then you'll have this infinite game of phone tag until everyone just gives up and the status quo remains.
Yeah.
Right.
So when a doctor, like say yourself, you're reaching out about a patient, is that like, are they all Nova Scotian users, or is it, broader than that? Because I know you've expanded beyond, like, is it, my terrible comparison was going to be like, is it like Tinder? Is it people like in your area sort of thing? Or what are we looking at when it comes to that side of it?
Yeah, so it's jurisdictionally bound.
Okay.
So all the people who are discussing are sort of working within the same jurisdiction. And so it's sort of people within your own community and whatnot. Now there's a bit of a nuance. So with Prince Edward Island and Nova Scotia physicians do collaborate. Okay. And that's just, again, kind of trying to help, sort of equalize or help the distribution of expertise across geographic regions. So, but yeah, it's jurisdictionally bound.
Okay, Very cool.
So how has this technology improved healthcare outcomes for patients? You have a focus on those in rural or underserved areas, and you just mentioned, sort of that balancing act with PEI. But what does that impact look like for those folks?
Yeah, so really the idea is, if you think about like a referral in general, any doctor or provider can send a referral. And a referral is essentially saying, look, like I don't know what to do next. It's asking a question. That's what a referral is. It means I don't have the knowledge or experience or skills for the next step that this person needs. And that's all it is. So now the way it's done, of course, historically, is you send a piece of paper to someone else and ask them for help. It's essentially like sending a letter, except it's by fax, but anyway. So really what this does is, through conversation and dialogue, it, in many cases, can actually take the place of a referral. And so that's really what it does. And we've done sort of we have 2 published studies now with Nova Scotia Health. We have actually replication with Prince Edward Island now as well, that shows that actually 84% of the time those conversations prevent the need for a formal referral. So they've resolved the case. So basically a patient can get, their family doctor or provider can get that expertise immediately and implement it immediately.
Wow.
Rather than having to wait a year, 2 years, 3 years.
I'm sure over time, the ability to then say, what's the impact on the stress on the healthcare system from a wait time standpoint, or an efficiency standpoint, how much dollars are being saved? A case could be made for, here's some real tangible results.
Oh yeah.
Yeah.
Yeah, and there's cost effectiveness data as well. It saves the system considerable money. It makes it more efficient. But really, it just saves time and gets people care now and prevents suffering and anguish and further complications. It's
If you think about the way too that we communicate, in a standard place of work, depending on whatever industry you're working in, just that immediacy of when people send an email, sometimes it would take a long time to get a response back from someone, but now you have things like Teams and Slack and ways to communicate with people very quickly. The expectation, for that instant knowledge transfer is something where there's such a gap between healthcare and being able to get that treatment and what we're used to. If I need to text someone, they're going to text me back right away. If someone doesn't answer right away, sometimes it's like, are they okay? Because, I haven't received something within 30 seconds. Yeah. So the fact that that's bridging that gap, I think is, what an impact that, that has. Yeah.
Do you have numbers or stats on just how many primary care providers or specialists are actually using the platform?
So currently there's over 5,000.
Wow.
Yeah.
Okay.
Yeah.
I would have to assume that that's beyond Nova Scotia then.
Yes.
Obviously Prince Edward Island. Are you across the entire country at this point?
Yes. Yeah. So we're not in every single province, but we are operational across the Atlantic provinces, Ontario, and as well in British Columbia. Yeah.
Forgive me for not knowing this. It should have been part of my homework. When did Virtual Hallway actually launch?
Good question. So our very, very, very first little prototype was launched in 2020.
Okay.
And that was essentially done with the 3 psychiatrists and a very, 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 very rough app. And we told a few family doctors about it, and it sort of took off. And then we didn't know what to do. And so eventually it evolved into a business, but it was really started as just the service.
What, probably just rapid growth would be, I'm sure, one of the biggest challenges, but what sort of challenges did you face when you saw that very quick expansion?
So, one of the interesting things I think about Virtual Hallway is, well, we solve a problem for the system. That was never really our intention. And it was always to solve a problem for the doctors who use it.
Yeah.
And it was always that sort of, so, while a patient is waiting on a wait list, the doctor who's actually referring them, that causes an immense amount of stress. It literally keeps people up at night. So we were always kind of really working at okay, well, how do we solve that problem for them and make their day easier and their practice easier? And similarly then for specialists, how do we make it helpful for them? And so that's sort of always been our ethos. And then we kind of knew if we make their life easier and their practice better, it will help patients too. And that's sort of how we kind of conceptualize what we do on a day-to-day basis. So with this sort of rapid growth, it was very grassroots, right? It was doctors were using it, and initially that's a fairly rapid change. And systems get scared when things change. So as some of our sort of initial obstacles were sort of like explaining this to systems and like what's going on, because it was like what's going on. This wasn't part of the plan, but ultimately. Working within the system has actually been quite helpful in scaling virtual hallway later on. But early on, there was a lot of explaining to do.
I'm sorry, I'm going to ask another one, Greg. I do this to him all the time. I apologize. I just take over the conversations. It's the journalist in me, I'm sorry. Walk me through how we've, through this platform, essentially like eliminated the need for referral, because from a patient standpoint, do you not need that paperwork to go from, point A to point B to booking in with your specialist, or how does that, like, how does this actually change that dynamic?
Yeah. So sometimes an in-person is still needed, right? So let me give you an example of I can give you kind of two examples of how this can work. So let's say in psychiatry, someone has depression, and they've been working with their family doctor and their therapist. They've been getting psychotherapy. They've tried a few medications, and it's just sort of like kind of plateauing or not getting better. So this is where a psychiatrist can talk to the family doctor. I mean, usually family doctors known the person for like 10 years. Mm-hmm. So in a way, that conversation is really good because you get 10, 20 years of information and this longitudinal perspective. And then can kind of hear the story, understand the background, understand what medications have been tried, and then suggest, oh, okay, well, this didn't work, and they had this side effect. What I would try next is this, and if that doesn't work, I would try this. And maybe the therapist, if they've tried this form of psychotherapy, try this one. And that's very often going to be the kind of recommendations that are going to be made after a lengthy psychiatric assessment. Mm-hmm. So in that sense, those next steps can be provided through that sort of in-depth discussion and dialogue. And the dialogue is super, super critical because it allows that back and forth between, both of you appreciate the value of dialogue being on a podcast, so that's what these facilitate. Now, on the flip side, let's say sometimes something surgical might actually need to see the specialist. Mm-hmm. And one of the stories that was really important that came out early from Virtual Hallway was an ear, nose, and throat surgeon. They'd had one of these consults, and this person was already sent in on the wait list to see them, and was going to wait a very long time because it was sort of a benign history. Yeah. But in that dialogue, the surgeon realized that there's actually something much more suspicious, and they realized the person had a cancer.
Oh, wow.
So then they were able to say, okay, actually, this person needs to be seen.
Yeah, needs to jump the line a little bit.
And they were able to kind of see them and intervene much earlier than would have happened otherwise. So there's a lot of clarification that can happen through this. So that would be a case of it didn't avert a referral, but it got the person better care.
Amazing. And I mean, it just makes sense to have, like you say, my family doctor delivered me. He knows my entire health history. So for me to then, try and communicate with the next person that I'm seeing, even just the idea of having to continuously repeat the story again and again to each new doctor that you're seeing.
Exactly.
To be able to eliminate that, it's the wait times for just a regular appointment with a GP are, I'm sure, extended because those conversations are having to happen. So if you can eliminate that, even just that in itself seems like a win.
Yes. Yeah. Absolutely.
Cool. More time for fine tuning. All of that.
Absolutely.
Yeah.
Next question would be really around how you guys are expanding the platform's reach. What does that look like for you guys, and how has this growth influenced the mission and operation of it?
So so basically the way we're growing is our growth has always been, I guess, with people's term, organic. Mm-hmm. It's not like paid growth or anything like that. And usually what we'll do is we work now with health systems and sort of to integrate us within their system, and then we launch in a jurisdiction, and then that allows all the doctors and nurse practitioners and other primary care providers and specialists to kind of load onto the platform and utilize the software.
Cool.
So that's generally how we grow and expand into other jurisdictions. And then the other aspect to our platform is education. So that education arm of the company really started because specialists were saying, hey, I'm getting a lot of the same questions. And it seems like there's like this maybe a bit of a knowledge gap in this area. Can we do like an online lecture or something like that? So we facilitate a lot of online lectures where a specialist will talk about a specific topic and the kind of the latest in that area that are really clinically relevant.
So from a doctor's perspective, like how would like getting this implemented? Obviously, we see how the benefits have played out, but from just an operational standpoint, like how does like billing, how does that all get sorted out? For the patient or the doctor, is that done through like MSI? Like how does that work?
Yeah. So these conversations are billable events under the public healthcare system. So I really want to make clear, no patient ever pays for this, except through like usual way you'd see your doctor, which is through tax dollars going through. Right. So these are insured services, and so basically the way that works is through the platform, any of these interactions are documented, and that those billings can be submitted to the ministries, and then the ministries can actually reimburse the doctors for that.
Okay.
Yeah.
Very cool.
So.
Very cool. What keeps you motivated to wanting to be, keeping up with this and doing this? I'm sure it's a lot of work. You wear more than one hat in your role at Virtual Hallway. So what is it that impact? Is it, the idea of the growth? What is it?
So, I mean, the mission is really what drives everyone at the company. So, the size of the impact we can have, and one important thing is like Virtual Hallways, there's now 55 different specialties on the platform. So it works across all of medicine.
Wow.
And it's that impact that we're able to have, the fact that we're able to, provide a tool that can really work sort of within medicine to allow, allow people to get faster care, better care that can kind of reconnect the medical community a little bit. That's really sort of that mission drives us. Like that's, day after day, we kind of look at the numbers and the impact that it's having, and that's really important. But on a day-to-day basis, what keeps me motivated is the team. Everyone there is just a very special person, and constantly sort of like working alongside people who are like continually breaking new ground and learning new things and like kind of hitting new heights. It kind of keeps you going and motivated to keep up, and just sort of what you're witnessing is sort of like this incredible growth of a company, but also personal growth of the individuals. So that's on a day-to-day basis what keeps me really engaged.
Okay, now we have to talk about the team because you've been giving them little shout outs here. Who do you have on there?
So our team is right now, there's a total of 13 of us, including the founders. So we're a small but mighty team, and we have all of our software is built in-house. We don't outsource anything. We run our operations in-house. Our business development, everything is run in-house, and we're actually an in-office culture. So we're constantly collaborating and working together. So. Cool. It's a really great environment.
That's really neat. And that, I think, obviously digital, Nova Scotia digital, we're talking about tech and innovation and whatnot. So that, I think, kind of ties into, that side of it, that you guys, you build the software, you have all that within what I think at its core is, a healthcare system innovation, which I think is kind of neat.
Yeah, absolutely. And I think the innovation really comes from the collaboration. So it's, so people who are, so, I mean, everyone does support tickets, for example. So everyone's continually engaging with the people who are interacting with our platform. But people who are going out to new jurisdictions and, talking to people, well, they're literally across the hall from the engineers who are going to build the software. So everyone's kind of constantly understanding of what's going on in different parts of the company, which allows sort of new ideas to form and new solutions to come up. And I always thought, kind of strongly believe that, usually the answer to the problem in one discipline comes from someone who understands a different one. So, an engineer might be able to solve a business development problem in a way that someone in business development won't. Exactly.
Yeah.
So
new perspective.
So we continue to have those kind of loops within the company, and that's been really, really powerful.
Wow.
Very cool.
So, looking 5 to 10 years down the road, what would you say are your goals or your vision for, where Virtual Hallway will be? And are there any new features or expansions on the horizon?
Yeah, so our ultimate goal is to, I never actually sort of explained the name. The name Virtual Hallway comes from a historic name for something called a hallway consult. Mm-hmm. So hallway consult is, if you can think back when doctors were all in the hospital, you would cross paths with a specialist in a particular area in the hallway, mm-hmm. and then you go ask them a question. And that was called a hallway consult. So we're trying to make that a modernized version.
Nice.
But the important thing is that is something that exists in all of medicine all over the world. And it's a cultural thing. So so our goal is essentially to become the ultimate hallway consult tool and expand across the world.
Amazing.
It's such like a digital take on something that the idea of if it ain't broke, don't fix it, right? We got to kind of get back to that, original plan, but you have to, keep it up to date.
Yeah.
And that's how you do it, right? And I mean, the other idea too, like you say about that idea of somebody else from a different discipline or department or what have you might be able to look at a problem differently. That expansion of that ease of access happens when you put it on a virtual platform.
Exactly.
Yeah. Very cool.
And really sort of in terms of the tech, everything we do sort of tech-wise. So we could talk about there's integrated aspects of AI within the platform but it's all sort of in service of that idea of we essentially want to make it that crossing paths with whoever you need in the hallway happen for people whenever they need. So that's sort of any tech changes that we make or any adaptations or expansions are all geared towards trying to recreate that experience on demand.
Nice.
Amazing.
Organic, like you said.
Yeah.
Okay, a little bit of a shameless plug here, but also a plug for you guys. Virtual Hallway was a finalist for the Best of Tech Award at the 2024 Tech Forward Awards this year. What did the recognition of being a finalist for that award actually mean for you guys and all of the hard work that you've put into this?
Yeah, I mean, it's the recognition is great. I mean, we're sort of like this mission-driven company, and you're continually working and grinding and trying and failing, and then sometimes succeeding. So, that sort of path. It's it's a lot of hard work and a lot of thought and energy is put into it. So those sort of recognitions like this are sort of they serve as a bit of validation and just kind of let us know that it's not just us who see it.
Yeah. You're on the right path.
A moment to take pause and just realize, you guys have spent however much time, deep in the weeds of, trying to solve these problems, and then just to realize, here's some great stories of people who have used the service and the impact that it's had. I'm sure that's extremely rewarding as well, and gets back to the core of why you guys started this in the first place, running upstairs and knocking the door and saying, here's this idea. What a great way to be able to have other people recognize that as well.
Yeah.
Is there any piece of advice you would give to aspiring innovators in healthcare?
Or would you like to keep it all for yourself and any future ideas?
I guess so probably two things. I think there's two things I would say I see. So first is just sort of, I think, in terms of getting going. I think the way to get going is actually just to get going. And I think a lot of people that I speak to and whatnot feel like there's some sort of like magic thing that has to come together to get started. And I think that's not true. I think you just have to do it and again, get going and trust and know that it won't be easy and that people won't get it at first. And actually, I think that if people get your idea at first, you probably don't have a good idea or a novel idea. Because by definition, if you're coming up with a new idea that's going to change how things are done, the status quo shouldn't see it. So it's actually like a good signal if people are like not quite getting it or think, oh, well, that won't work.
Interesting.
that might be a signal to go. Now, sometimes it can also be a signal that it's not a good idea. But if everyone around you is saying, this is great, you got to do it, you might just be sort of doing a red ocean activity.
Right.
So that'd probably be one piece of advice. The second, I would say in healthcare that's worked really well for us is we call it like focusing on our primary. And what that means to us is, so in healthcare, you have all these stakeholders. You have governments, you have payers, you have patients, you have providers. And the bad news is you cannot be all things to all people. You can eventually, but you have to kind of get clear, I think, in your mind who you're going to primarily focus on when you're building, when you're creating things, like who above all else are you going to help? And because that'll help you make decisions. I see a lot of times, like when ideas that trying to kind of be too many things to too many people early on, it's a lot harder to kind of get off the ground as a result, because then you end up being nothing to anyone.
Yeah.
So
Yeah.
so those would be my two kind of pieces of advice that I would.
Those are really good.
Yeah,
Sound
hopefully.
advice.
Yeah.
That's
Yeah.
And I think probably applicable beyond healthcare and innovation.
Yeah. So kind of focusing on who you're helping.
Nice.
Yeah.
I feel like, this is like our own little psychiatrist
I know.
session that we
I
said
know.
here. I was like,
Who do we
this
build
is great.
to? Does MSI cover this?
Yeah.
All I need is just to kick back on a leather coat and I'm good to go.
right?
Yeah.
Man, talk about a podcast consult,
I know. What a great closing.
Okay, well, with the idea of closing in mind, we're going to hand the floor over to you. Is there anything that you want to chat about? Did we not touch on something that you would love to get out there for the folks that are listening?
No, I mean, I think I guess the thing, for people that are listening, I don't really have too much to add, but maybe just to kind of build off the last comment about you can't appease everyone, and I think that's true early on, but you can eventually, and I think Virtual Hallway now is at a point where we still focus on our end users, but because sort of that initial theory that if we make life easy for them, then they will help patients, and then that will help systems. We now work really closely with health systems, and they're absolutely excellent partners. So and I think maybe that's some to aspiring people in healthcare, is it can take a while to kind of develop those relationships and build the credibility and trust with a healthcare system. And that's just how it has to be, right? Like a healthcare system can't just adopt all sorts of new technologies all the time, because they have to worry about population level risks, and so kind of be patient with that, but they can be really great to work with once you get kind of when you yourself build up your credibility and your
Nice. That support is there.
Definitely.
Yeah. Incredible. Good. Happy to hear that. I lied to you. I said I wouldn't ask another question, that we were done, but I do have one left. What happens if your doctor is not on Virtual Hallway? Can you send a note? Can you tell them, hey, get on it? What are we looking at there from the patient side of things?
Yeah, so that's probably the biggest flaw with the entire system right now, and that's something that we want to figure out, but we have not yet. So ultimately, Virtual Hallway is not patient-facing, right? So you do need a provider who
That's
can, and we always kind of say that's the biggest flaw, because in Nova Scotia, I think it's around 10% or maybe even slightly higher. People don't have a family doctor or a primary care provider, so it's hard for them to get someone to use Virtual Hallway. Now, some of the walk-in clinics and things sometimes provide a bridge, but it's that's
the next task.
That's a problem to solve for sure for us.
Primary care, your nurse practitioners.
Yeah, but it is very easy for them to sign up and use it.
There we go.
Yeah.
How do they do so?
They can sign up on the website, and then we verify the providers from there. But
Lovely. Okay, now I promise I am done. Greg, did you want to throw one more question in there, Adam?
No more questions. I think the story of the brand has been fantastic. It's great to be able to learn about what is driving the creation of these amazing businesses that are working within the tech sector, and the health community as well. I'm a brand guy. I love the brand that you guys have. that open doorway to a
yeah.
hallway full of possibilities, I think is fantastic. So encourage people to learn more about Virtual Hallway and the amazing work that they're doing, and get out there and support them.
Yeah, absolutely.
And actually, maybe one thing I will add, if it's okay.
Of course.
Yes, so we are growing, so keep following us. There will be increasing opportunities, we think, at Virtual Hallway. So I don't know if I'm allowed to say that, but
you
I thought,
absolutely are,
okay,
yeah. So should we just like say
Check
it
out the
outright,
DNS
or
job.
check out our job portal.
Yes.
So you might see this guy on it.
Yeah.
Exciting. That's great. And growth, I mean, obviously, like from a user standpoint is great, but also growth within the company is also fantastic. So that's exciting too for a different reason.
Yeah.
Cool. All right. Check out the job portal. Thanks so much for your time, Daniel. We really
Thank
appreciate
you.
it.
Thank you.
Recorded by This Is Marketing, unblanding branding since 2015.